I'd like to welcome you all. In this short video, we will examine the liver systematically, which is very important in every US examination, especially for cases with intra-abdominal or intrathoracic malignancy. Our landmark is the inferior vena cava and the insertion of the right hepatic vein inside the inferior vena cava. We locate the echo endoscope at the cardia, about 40 centimeters from the dental arch, and then try to do gentle clockwise and anti-clockwise rotation to locate the inferior vena cava and the right hepatic vein. If we find the aorta, we can do counterclockwise rotation, gentle, and we'll find the inferior vena cava and the right hepatic vein. The right hepatic vein is characterized by the widest diameter of the right hepatic vein is at its insertion inside the inferior vena cava. So the widest diameter is here, with gradual tapering or gradual decrease in diameter when it runs inside the renal parenchyma, and this is the portal vein. So our landmark is the inferior vena cava and the intrahepatic portion of the inferior vena cava and the joining of the right hepatic vein inside the inferior vena cava. Its widest diameter is at its insertion into the inferior vena cava with gradual tapering as it goes deep inside the renal parenchyma. So very nicely seen. Yes, right hepatic vein, inferior vena cava, intrahepatic portion of the inferior vena cava, and the portal vein. Here this is segment 1, which is the caudate lobe in between the echo endoscope and the intrahepatic portion of the inferior vena cava, and segment 8 in between the inferior vena cava and the right hepatic vein, and part of segment 7 behind the right hepatic vein. So this is the inferior vena cava, intrahepatic portion of the inferior vena cava, right hepatic vein, widest diameter is here with gradual tapering when it goes away from the echo endoscope inside the renal parenchyma, and this is segment 1, the caudate lobe, segment 8 in between the inferior vena cava and the right hepatic, and part of segment 7 deeper to the right hepatic vein. Then we start to do counterclockwise rotation. When we do counterclockwise rotation, we expect it to find the middle hepatic vein. Contrary to the right hepatic vein, the middle hepatic vein usually has the same diameter all over its course inside the liver, and it is a long vein. We can see a very long part of the middle hepatic veins with nearly similar diameter from its insertion inside the inferior vena cava and its beginning part here inside the liver. So it is homogeneous diameter, very long part can seen of the middle hepatic vein, and here we can visualize a whitish or echogenic band communicating or going from the inferior vena cava to the umbilical portion of the left portal vein. This is the ligamentum venosum. Okay, very nicely seen, ligamentum venosum, middle hepatic vein, umbilical portion of the left portal vein, and here the inferior vena cava. Here the segments is segment 1 in between the echo endoscope, which is the caudate lobe, in between the echo endoscope and the ligamentum venosum, communicating the inferior vena cava with the left portal vein. This is caudate lobe, and in between the ligamentum venosum and the middle hepatic vein, this is segment 4A, and behind the middle hepatic vein is segment 8, a large area of segment 8. So this is 1, 4A, 8, and this is the ligamentum venosum communicating the inferior vena cava to the left portal vein, umbilical portion of the left portal vein, and this is the middle hepatic vein having the homogeneous diameter, and we can see a long part of it during echoendoscopic examination. Yes, very nice. 1, 4A, 8. 1, 4, 8. Then we keep counterclockwise rotation, counterclockwise rotation, counterclockwise rotation. We continue counterclockwise rotation to see the left hepatic vein. This is still the middle hepatic vein, and this is the inferior vena cava. We will keep doing counterclockwise rotation. Yes, very nicely seen left hepatic vein. And this is segment 2, and this is segment 3, opposite to the anatomy. The anatomy is saying that the left hepatic vein separates segment 2 and 3 at one side and segment 4 at one side. But during EUS examination, this is segment 2 and this is segment 3. This is segment 2 and this is segment 3. And here segment 2 is a best segment for interventional endoscopic ultrasound in biliary drainage. It is very good for rendezvous technique and antegrade biliary stenting because it is more in line with the left hepatic vein with the common hepatic and common bile. While segment 3 is very nice for hepaticogastrostomy. But segment 2 is very nice, is very suitable for rendezvous technique and antegrade biliary stenting. Okay, then segment 2 and segment 3. So we start with inferior vena cava and right hepatic vein. Counterclockwise rotation, we can go to the middle hepatic vein, and continuing counterclockwise rotation, we'll go to the left hepatic vein and segment 2 and 3. Okay, this is the left hepatic vein, segment 2 and segment 3. Then we will do the opposite, clockwise rotation. Clockwise rotation, we go back to the middle hepatic vein and inferior vena cava and the ligamentum venosum. And more clockwise in the opposite direction, clockwise to go back again to the inferior vena cava and the right hepatic vein. And segment 1, 8, and part of segment 7. So by counterclockwise and clockwise, we can go from the different hepatic veins. This is the middle hepatic vein. Yes, and more counterclockwise rotation again to the left hepatic vein. So by counterclockwise and clockwise, we can go from one vein to another. To repeat again, when you locate the inferior vena cava with the right hepatic vein, then when we do counterclockwise rotation, we will go to the middle hepatic vein, more counterclockwise rotation to go to the left hepatic vein. If we do the opposite, we do clockwise rotation, then we will go from the left hepatic to the middle and clockwise to the right. So we can go here and there to examine all the liver segment. Okay. Now we'll continue to go to someplace else. We will push the echo endoscope forward to go to what is known as fish eye appearance. The fish eye appearance is the left portal vein. Here, this is the left portal vein. By simple pushing the echo endoscope while we are visualizing the middle hepatic vein. Just go forward with mainly counterclockwise rotation. We can go to the fish eye appearance. Fish eye appearance here is the left portal vein, and here we can find a very important ligament, which is the ligamentum teres, and here is the ligamentum venosum, the previously mentioned ligamentum venosum. Okay, we will continue. Yes, this is the fish eye appearance, left portal vein, and here this is very nicely seen ligamentum teres. Yes, this is ligamentum teres. Here the area above the ligamentum teres is segment 3, and below it is segment 4B, and below the fish eye appearance is 4B, 4B. So this is all this area is 4B, and this area between the echo endoscope and the left portal vein and the ligamentum teres is segment 3. So this is segment 3 and segment 4B, 4B, and 4B. Then let us continue. This is a very nice fish eye appearance, left portal, and segment 3, and segment 4B, 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 and this is the ligamentum teres. And when we draw the echo endoscope up, we will go to ligamentum venosum and the middle hepatic vein again. So pushing and withdrawing the endoscope, and this is the segment 1, which is the caudate lobe, segment 4A and segment 8. The previously seen segments. So when we are in this view with the middle hepatic vein and the ligamentum venosum, when we push the echo endoscope inside the patient, push it forward, then we go to the fish eye appearance and the ligamentum teres, and when we withdraw it back again, we come to the ligamentum venosum and the middle hepatic vein. Okay, let us continue. So this segment 1, 4A, and 8. And now we come back to the inferior vena cava and the right hepatic vein, and segment 1, 8, and part of 7, counterclockwise rotation to the middle hepatic vein and segment 1, 4A, and 8, and more counterclockwise to the left hepatic vein and segment 2 and 3. So the summary of this video, that we can start with the inferior vena cava and the right hepatic vein, and starting to do to localize the segments 1, 8, part of 7, and then counterclockwise rotation to go to the middle hepatic vein and 1, 4A, 8, and then more counterclockwise rotation to go to and 3, and go back to the middle hepatic vein, and then pushing forward to go to the fish eye appearance, left portal vein, and pushing forward again, more forward to go to the ligamentum teres and segment 3 above and 4B below. So it is, I think it may be a simple way of examination of the liver, but all some like to start with the left hepatic. I'd like to start with the right hepatic. So all ways of examination are right, are correct, and I think, and I'm always saying that the best way of examination is the way you are used to do and the way you are perfecting. And this is examination of the liver from the stomach. We can see most of the segment of the left lobe. We can see segment 8. We can see part of segment 7. But the other segments, especially 5 and 6, is better, or it may be only seen from the duodenum. And thank you very much.